Se va a bañar.
So, vamos a tapar la cama y como les dije, lo mejor sería una cortina de plástico. Pone esa allí.
Una cortina de baño.
Sí. Después vamos a agarrar una colcha. Porque después que pongamos la sábana mojada tenemos que envolverlo con una colcha. Okay? So we're going to use a blanket, preferably a wool blanket, because you want to warm the person.
Es bueno colocar una cobija o una colcha para que podamos cubrir al paciente y calentarlo, mantenerlo caliente, aunque va a ser con hielo.
And then we're going to take the sheet. So this sheet, we're going to fold it. This is a huge sheet. I couldn't find a smaller sheet.
Esta.
¿Es más pequeña? Pero
no
sábana.
importa, que sea sábana, sea.
Pero le va a tapar ahí, le va a alcanzar ahí el zapato. So this is not really a sheet, but you're supposed to use a sheet, okay? ¿Me ayuda aquí? So you're going to spread it out, and you're going to take the two ends and bring it to the middle. And then we're going to take this, bring it in to the middle, and then we're going to fold it this way. So did you all see that? Se va a doblar, lo vamos a agarrar
Las puntas y se doblan a la
a
mitad.
la mitad, después las otras puntas a la mitad y después vamos a cerrar. This is just to make it easier for when you put it in the ice water. So you can put it in and wring it out. We're gonna take this, you're gonna put ice in a container, you're gonna have that ready, and you pour some water in it. You still want some ice in that water. Entonces eso vamos a agarrar un traste con hielo y vamos a llenarlo de agua. Cuando usted haga eso, usted necesita tener hielo todavía. We're gonna soak this in that water completely.
Vamos a sumergir la sábana completamente en el agua con hielo.
Soak completely, and then because it's folded this way, it's easier to wring it out because you don't want this dripping.
Como está doblada de esta manera, es mucho más fácil escurrirla porque usted no quiere ir a regar agua por nada.
Okay? So you wring it out, and then we're gonna be able to do this quick because we already have it folded the right way. Ven,
Yo sé. Digo, Alex.
aquí está la cabeza.
Pero está seco.
The person has to be naked. Naked. If they want to keep their brief on, that's fine, but as naked as possible. Because you want this wet sheet, you want the wet sheet to touch as much of the skin as possible. So the first thing we're going to do is bring esta mano aquí arriba. Put this hand up, and I'm going to take this side of the sheet. I'm going to bring it across, and I'm going to tuck it in tight. No, I'm going to tuck it in, right? Because I want as much of his skin covered. The bottom part, I'm going to take this, abrirlo aquí un poco, no, abiertos, no, bájalo, y este para acá. And I'm going to take this side, and I'm going to tuck it in. As much as possible, we can ask him to tuck it in farther, and make sure that the sheet is touching as much skin as possible. I'm going to come over to the other side, bring this hand down, and I'm going to bring this and do this. And we're going to wrap that leg the same way because we want as much skin touching the sheet as possible, okay? Then we're going to take the blanket. We're going to take the blanket and we're going to wrap him completely. We're going to wrap him and we're going to do the same thing here.
Como una momia.
So we can use a towel up there.
Towel o otra
Esta
sábana.
aquí. Because we don't want no air going in. So we can use this towel. Levanta la cabeza. We can do this so that we're sure that there's no water and no air going in. ¿La puedo chiquita?
the cloth around his
están
neck, is
mojadas.
that cold?
No, that's dry.
Dry,
Dry.
okay.
Okay. We're gonna have a little container with ice nearby. You wanna make sure you have that near you.
Está mojada, no importa.
So remember the sheet was cold, right? Ice cold. It's gonna take about 2 or 3 minutes and he will start sweating. Maybe less than 2 minutes. And he will start sweating and you're gonna see around his face. This treatment, when you're doing this, you have to be by the patient.
By
You
the
can't leave the patient.
Debemos estar todo el tiempo con el paciente cuando hacemos este tratamiento porque después de 2 minutos, aunque va a estar envuelto en una sábana fría, él va a empezar a sudar y se le va a ver cuando veamos su rostro. Entonces todo el tiempo tenemos que estar con el paciente para irlo
Always
chequeando.
have the patient's water nearby, and if you have a straw, it's better because he's gonna start sweating. The cold sheet is gonna make the body sweat. It's gonna provoke sweating. So you have to have this water nearby with a straw so you can give it to him. And keep asking, how do you feel? Do you want some water? If the patient starts sweating,
Debemos mantener agua preferiblemente con un sorbete cerca del paciente para que él pueda estar tomando agua y tenemos que estarlo chequeando y preguntándole cómo se siente.
if he starts sweating, you take a washcloth, put it in the ice water, wring it out good, and then we're gonna put it on his forehead.
Como el paciente va a estar sudando, usted va a tener agua, un container, una vasija con agua con hielo cerca de usted y una pequeña toalla y va a ponérsela en la cabeza cuando esté sudando.
So, like I said, depending on what you're doing it for, you can stop it anytime. If the patient feels bad and tells you, I feel bad, you have to stop the treatment.
Call
Si el
911.
paciente empieza a sentirse muy mal y
Call
usted
911.
constantemente le está preguntando, pero si se siente muy mal, entonces paramos el tratamiento, pero el paciente hasta que...
I don't know. For COVID patients? For COVID
For
patients?
COVID, like before they got really bad, like if they're feeling nauseous or not.
So the best one is the contrast baths. That's the one,
Contrast
yeah,
baths.
that's the one they
Recommended for
recommend for
before
COVID.
bring your
The
immune
contrast. Those are the best.
Shower one.
Yes, the shower.
Bueno,
Half
entonces,
hour
entonces.
showers.
Okay.
I mean, you can do that even if you're not
Sí, no,
sick,
no, no.
just to keep your body ready to fight when you. Okay. So if you just wanted to lower his temperature, and you see he starts sweating, you know, and you check his temperature, he's low, you can stop it. If you need to do it for insomnia, for anxiety, for depression, then you just keep going on with the steps.
Para pacientes con ansiedad o con depresión es muy bueno este tratamiento.
So you could if you want to just do it 20-30 minutes, or if you want to keep up to 40 minutes, it just depends.
Puede ser 20-30 minutos o si lo quiere mantener por 40 minutos.
After you do the treatment, I'm going to take this off because it's going to finish.
Con tu sweating.
Sí, vas a sudar. So after he's finished,
Después de
they
que
need
él
to
termine,
rest. They need to rest.
la persona o el paciente debe reposar.
Make sure they're drinking water.
Asegúrese
during
que
the
esté
treatment,
tomando agua constantemente
and let them rest 1 or 2 hours.
y lo dejan reposar por 1 o 2 horas.
Y el alivio.
Sí, está muy caliente. I had it done, and I think in about 2 minutes after I started the treatment, I started sweating, and I was just pouring, and I started feeling dizzy. And I told them, I said, I feel dizzy. I felt bad. And when they put the cold rag on my head, it went away. And it felt so good. This is a treatment that you can do if you're feeling tired, it relaxes you.
Después de que si la persona se siente muy mal o empieza a sentirse mareada, ella dice que cuando ella se lo hizo se sintió así y que tan pronto le pusieron la toalla fría en la cabeza se le quitó el mareo.
Yeah, just remember that when you're doing this, do not leave the
Es por el cambio de temperatura que hay en el cuerpo y entonces acuérdese que el cerebro reacciona y tiene reacción al caliente o cuando la persona está sudando. Entonces el agua fría en la cabeza pues
Wet sheet.
nivela.
Una de las cosas que yo cuando estaba estudiando esto, dice que una de las reglas principales de la hidroterapia es cabeza fría y pies calientes. Entonces siempre es como mejor como prevención poner siempre paños fríos y siempre cubrir los
Un
pies.
tratamiento que es muy bueno para el dolor de cabeza es el poner los pies en agua caliente, lo más caliente que pueda, y en la cabeza paños de agua
So she was
con agua fría.
mentioning that when she took the treatment, they told them that
One of the rules.
one of the rules is to have the feet warm or hot and the head cold. That's something basic. So she was saying that the best treatment for headaches is doing a hot foot bath and using a cold rub on your head. Because it pulls, the warm water pulls the blood. So it relieves the headache.
Bueno, ahora vamos a explicar, vamos a quitar